Live, local, late-breaking. This is WBAL TV 11 News at 5.
An active lifestyle briefly brought to a pause on the soccer field.
I initially thought my leg was broken because it was really loud, and then I looked down and it looked fine.
In fact, Amy Sylvia tore her ACL. The new procedure, though, she received at Mercy Medical Center that got her back on her feet.
In tonight's Women's Doctor, a new procedure to help repair an ACL tear is getting young women back to the sports they love. 11 News anchor Lacey Griffith talked with the Mercy Medical Center doctor, and he says with this new procedure, there's only a 4% chance of re-tearing your ACL.
Amy Sylvia is an active 30-year-old athlete. But about a year ago, during a game of soccer, one moment changed everything.
I was running up to challenge for a ball on a 50-50 ball, and the other player came in and collided with my left leg, and then it basically made a very loud snap.
The diagnosis, every athlete's worst nightmare, a torn ACL. That's when she connected with Mercy Medical Center Dr. Mark Slabaugh.
She's very, very active, wants to go back to soccer. She says she was playing either 4 or 5 games a week, and those type of patients, because of her age, because of her sex, and also because of the desired sports that she wanted to play in the future, we said she's a perfect candidate for this.
The procedure is called LET, or lateral extraarticular tenodesis.
We take a strip of that fascia, and then we put it under one of the ligaments called the lateral collateral ligament, and then dock it into the bone, and that provides 2 points of fixation in order to decrease the risk of them having what's called a pivot shift.
Dr. Slabaugh says he's doing these procedures more often, and with it comes a little extra time under anesthesia and a bit of a larger incision, like you can see on Amy's knee.
So I actually put weight on it the first day I got home. So I was only on crutches for like maybe 2-3 days, and most of the time I was only on one crutch.
Not even a year later, after putting in the work in physical therapy, Amy is back to playing the sport she loves. Dr. Slabaugh says it's important for young female athletes to do different activities throughout the year and change it up, so you're less likely to cause an injury from overuse of the same body parts. In Baltimore, Lacey Griffith, WBAL TV 11 News.